Thank you and good morning. Good morning. Karima here. I have been in emergency communications 911 for about 23 years. So I started when I was 2 years old. And everybody laughs at that. I love it. I love it. But one of the things I always get asked when I tell the individuals that I've worked in 911 3 different states, climbed up the ranks as call taker, dispatcher, recently left a stint of 7 years with Washington, D.C. as the director of the Office of Unified Communications, is what's my worst 911 call? So I will save you guys from asking me that at the Alumni Hour, and I will tell you what my worst 911 call was. This was back in the early 2000s. I was about 26, 27 years old, and I was a sergeant in Augusta, Georgia at the 911 center. And I had recently just had my son, who's 16 years old, and he's upstairs asleep right now. And I'm gonna text him when I leave here, make sure he starts his homework. But I received a call from a gas station owner, Citgo or Sunoco or somewhere. And he called 911. I answered the call, and he told me that there was a young lady that had walked into his store. This was like 10 o'clock in the morning. And she had 2 small children with her, one on her hip and one she was holding their hand. And she walked them into the bathroom, and she had locked herself in the bathroom with the kids, and they were crying. And he thought that she was whooping them. And if you guys don't know what whooping is, because I'm from the South, that is punishing your kids by spanking them. And so typical call, we get these type of calls all the time. So I got all the information from him, got his name, the address of the gas station, and I put this call in, send it out for police, check on a domestic. We got a young lady with 2 kids. She's in the bathroom. She's locked herself in the bathroom. And so while I'm on the phone with the clerk, I realized that the kids had stopped crying. And I said, oh, great. Has she come out the bathroom? Has she unlocked the door? Where is she now? He goes, no, they're still in there. I was like, wait, the kids were just crying. Abruptly, they stopped crying. Can you go knock, on the door, check on her, or whatever? And before I could finish my sentence, he starts screaming, the gas station owner. I go, what the hell, what? And he tells me that there is blood that is coming from under the door. And of course, every 911 call taker, my heart dropped to my toenail. I stood up, I was on a podium because I was a supervisor that day. I stood up and I yelled across the room to the police department that was being dispatched, and I said, step that call up. I simultaneously started typing to get that same call copied over to our EMS service, told them to get the call out. And then I also had to start again and start typing again and put all this information in to get the fire department out there for first responders. This young lady had took both her kids in the bathroom, and she killed both of them in the bathroom. They were 1 and 2. And that was my worst 911 call. Most 911 calls are bad. No one calls 911 on a good day. Everyone calls 911 on their bad day. But before I get into my presentation, I do not want to leave you guys with that thought. I will have some talk about how that call could have gone better with Next Generation 911. So the graphic I have up here of 911, there's one just particular graphic in the middle one with a cat. And I like to show this because when I first started working at 911 in 1999, we went over all these different protocols, and there was literally a protocol for if someone calls about a cat in a tree. People did call 911 about a cat in a tree. And our protocol was we would tell the caller the cat will come down when he's hungry or she's hungry. And that was the protocol. That was literally, we had to have a protocol for that because you had people calling 911 about cat in trees. Maybe it was only in the South in Georgia, but it happened. And so today what I'm gonna talk to you guys about is this concept of next generation 911. Those of you guys that work in local governments, And some of you guys in state and federal governments, I'm sure, have heard this term that has been floating around for almost a little over a decade now of next generation 911. I will not go through this entire timeline, but I put it up here so you guys can scan as I'm talking. But a little bit about the stats of 911 today. There are close to 6,000 911 centers across the country. Most jurisdictions have their own 911 center. There are different sizes. I have run a small, medium, and a large PSAP, DC being the largest PSAP I had, 3.5 million calls for service a year. The entirety of the United States 911 center takes 250 million calls a year for service. No, not all of them are the calls like I described earlier. Most calls come into 911 are not really emergencies, but everyone knows if you dial 911, someone is gonna answer. And so they call 911 for emergencies, non-emergencies, questions, information, the weather. Yes, people call about the weather. People call about events, they call 911. And so we have really focused on having other sources for individuals to call instead of 911 because we want to reserve 911 for emergencies. 80% of the calls now are being taken by cell phones, which is very unique and is actually one of the impetus for next generation 911. So 911 is 55 years old this year. 1968, under President Johnson, there was a recognized need that we needed a national number to call for emergencies. Of course, the first question my Generation X self asked my mother was, what did you do before 911? How did you get police and fire? And she goes, oh, you just call the operator. Or you just dial the full number to the police department. Or even before then, there were call boxes that some cities still have them up. You can pick up the phone and it directly connects you either to the fire or the EMS service. And some cities have actually used those as historical. I'm from 911. Hysterical was the first thing that popped in my head. And so over time, after 1968, in Alabama, the Senator Rankin, I believe, in Alabama made the first 911 call through AT&T. Our partnership with AT&T and Emergency Communications is strong and long. Made the first 911 call by dialing 911. 911 is United States, just so you know. In other countries, there's different numbers. There's 112, 999, 000, and I think 111. Africa, Europe, different places. So don't forget that. We hear about a lot of tourists going different countries and they dial 911 and don't get the emergency they need. So 70s, 80s, and 90s, there was this growth of communications. As we all know, B911 was the basic 911 that we had. You call 911, you get the 911 call taker, she dispatches, or he dispatches police, fire, EMS. Enhanced 911 came around, and that was the introduction of ANI, which just stands for Automatic Number Identifier and Automatic Locator Identifier, basically caller ID when you call 911. It will pop up and we can actually see your location and see where you are. And then, of course, VoIP came around in the 90s, and so you had to integrate that, and, of course, cell phones. And 911 back in 68 was built around landlines, right? So you call 911, you know where you are. There's this emergency services network. So the phone company said, if you're in this area of Monterey and you call 911 from this fixed location, you get this 911 center, which takes this police and this fire department. So then when you brought on VoIP and you had cell phones, they're calling off of IP. It's like, this isn't a fixed location. How do we fix that? Well, the solution, Band-Aid, was that you go off of the cell tower. Right? So when you call 911, you always hit, or you call anywhere, but you call 911, you hit a cell tower. Based off of that cell tower's sector, it then routes it to a selective router with our telephone provider, which is also fixed, and say, in this sector, this is the 911 center. The problem is, when you're calling 911, you're getting the cell tower, not the location of the caller. And so when you guys hear about location accuracy, device-based location, they're talking about the actual device location. That is also why you hear, why doesn't 911 know my location, right? I can call Domino's Pizza and they know my location, and that is why, because we're getting a location based off the cellular tower. We are graduating there, and I'll talk about that a little bit shortly. So basically, 911 is still operating like back in the 90s, in a sense, and Really think about that, how you communicated back in the 90s. I was in a car with my 16-year-old, and we were riding down the street, and I don't know how we ended up talking about it. I told him that, when I was in high school, we had beepers. You just dial the number, you call your boyfriend back or whatever. So my son, it didn't dawn on me. He had no concept of beepers. So he's sitting in the car, he's like, beep, wait, someone calls a number. It gets better. Someone calls a number, they put in their number, which sends a beep to you on a device. You can't use that device to call them back, though. You have to go find a phone to call them back. And I was like, yeah. And he goes, well, what if you're driving, or what if you're out and about? And I was like, oh, you just use a payphone. He's like, a payphone? What's that, Mama? It's like, oh, there were these phones that were in booths. They were spread out throughout the city. You stop, you put a quarter in, and you dial the number back that was on the beeper. And so my son, guys, if you ever want to have a fun conversation at the dinner table, he had so many questions. He's like, who put the booths up? I was like, the phone company. He's like, okay, what if someone else had to use the phone while you were using it? I was like, they stood in line. He was like, where? I was like, outside the booth. I didn't want to tell him that one time it went from 25 cents to 35 cents, and then we had to find a dime. And he asked me the most COVID question ever. He said, well, who sanitized the booths in between users? We didn't even think about that. I was like, no one. He's like, oh, Mama, So 911 is still operating like we did back then. And that is definitely a disadvantage for every single person in this room and every single person in this country. So what's needed? We know what's needed. Our vendors, the industry, our service providers, we all know what's needed. We need to overhaul the 911 system from its old landline communications to a more digital world, right? We need to be able to accept video, text, rich data, any type of information that a caller needs to get to us. We need to be able to dissect that, digest that, and get it out to responders. We can't do that. Every time I'm in some type of innovative setting with Homeland Security or individuals across the country that are working in really good things, the first thing I think in my head, and I know I'm biased because I worked in 911, is, the first call is going to come to 911. So we have all these things, these smart cities. We have trash cans that tell different agencies when they need to be changed. We have all this stuff. We have these different gadgets and things for our first responders. I was watching one the other day, and they were talking about that they have gloves for our firemen and firewomen that will actually keep up with their pulse and their blood pressure and their heart rates and things when they're in buildings. And I was like, well, where does it go? You want to say it goes to the command, right? The person on the scene, but the incident commander is so busy, and we understand that. But there's a group of individuals that are sitting in an agency, in a center, behind all this technology. You could send it to them. They can decipher it, and they can get it out. But without Next Generation 911, we cannot do that. So Next Generation 911 basically overhauls that infrastructure. It gets it updated where you'll be able to understand that. And there's two terms that I want you guys to know. I am not technical, so those technical folks that are going to challenge me at the end of this, I will try my best. But there is a EZNet, and then there's Next Generation 911. Next Generation 911 is the umbrella, right? It's the concept of graduating 911 to where we are today. It's the videos, the text, being able to link, interoperability, share calls. The EZNet is the literal infrastructure, and it just stands for Emergency Services IP Network. And that's literally the things we're going to plug in together. That's the stuff we're going to upgrade, the physical and the services, to make sure that Next Generation 911 happens. I know the next question would just do it, right? Do it. Why aren't you guys doing it? We're doing it very slowly and very piecemeal. There are only maybe a couple dozen or more 911 centers that are considered large 911 centers, so Chicago, DC, New York, and I work alongside them. We usually have some of the resources to get started on next generation 911, but there are a lot of 911 centers that do not have those resources. They're small. Most 911 centers are like 2 or 3 people, right? When you start thinking about these smaller jurisdictions, there's just 2 or 3 people that work in the 911 center that they don't have that representation. So there are 2 things that are missing to get next generation 911 realized across the country. One is coordination. Hint, hint, FirstNet. Coordination, we don't have that. We don't have a coordination. We have our industry that has been raising the alarm. You guys are probably now thinking, right, oh my God, where is my 911 center even in my city? But we don't have that coordination, and we need a federal level coordination to help the centers jumpstart and get to next generation 911. There is a concept in play with some of our industry partners called I3 under the National Emergency Number Association that has the concept in place. We have advocacy groups, and I'll talk a little bit about 2 pieces of legs that are out there in the House and the Senate that supports next generation 911, but we don't have that coordination. And I'm afraid it's because what we do, I don't even want to say what we do best. What we do worse in this country is we do things after the thing happened. FirstNet came after 9/11, right? And I don't want that thing to happen. I lived through a lot in DC in the 911 center. I bet you guys never even thought about how busy we were at the 1-6 insurrection. Yeah, right. Nicole, you're looking at me from HC. We were busy. And we were actually busy the weekends before, because a lot happened leading up to that. And so just thinking about what we go through, the amount of calls that we take in COVID, just, like all of us across the country, just really bad. Really took 911. That was really an eye-opener for our industry. The second thing that we need for next generation is money. There was a study done a couple years ago, and it was found that to get every 911 center across the country graduated up to next generation 911, $12 to $15 billion, right? Yep. My budget in DC was $125 million a year, and we barely made it with that 125. But $12 to $15 billion can get every 911 center in this country upgraded to next generation 911, which means when you call 911 about your baby not breathing, your husband having a heart attack, you have just got hit by a 18-wheeler, you will get the same type of service. We will already know your location. We can also reach out to your car's communication services. We can get video in, so you can send us video and we can send it out to the officers. That $12 billion, $15 billion, not only does the infrastructure, also training for our workforce. I know in our cohorts in the executive leadership program, we talked a lot about that. I think COVID definitely knocked us off of our high stools about the actual employees, the workers, the folks that are doing this. We're just piling technology. On them. I know now as a 911 call taker, I answered 911 for 8 years. From 19 years old to I don't know how old I was before I got promoted out and ended up in admin. And I could not today, superstar Karima 911 queen, could not answer 911 today because of the complexity. I just know mentally I could not do it. But we have individuals, I have individuals in 911 in OUC in DC that have been answering 911 calls for 30 years. You guys think they're traumatized? Especially if we're not training them. So that $12 billion not only does the infrastructure and the services, it also will help with training and upping our skill sets of our call takers and dispatchers to be able to handle these type of calls. And then the other thing is redundancy and interoperability. I know the panel earlier talked about collaboration. I like that word because interoperability sometimes have this technical, baggage with it, but collaboration. So I'll give you guys a good example. In DC, we take 50,000 calls a year that weren't meant for DC. They'll probably go to the surrounding areas because they're being misrouted. So 50,000 times my call takers pick up the phone and say, oh, I'm in Montgomery County, Maryland. I'm in Fairfax. I'm in Alexandria. Hold on. Baby not breathing, hold on. I got to get you over to Arlington. I got to get you over to Alexandria. Can you imagine? So interagency collaboration, interoperability, that is very important. One of the other things is redundancy. So DC is unique because we're not a state yet. We're working on it. But we don't have a backup. So my center goes down, which it did for 56 minutes in 2018, and I thought I was gonna get fired. I didn't. But our center went down for 56 minutes on a Saturday, black. You call 911, nothing. Not a dial tone, not a busy signal. You heard nothing. 56 minutes. Thank God no one was injured. All the calls, we ended up working through that a lot. But I don't have a backup. If something happens in DC, which happens all the time, and we get overwhelmed with calls, I don't have another center to back me up. Even in states that have other 911 centers that are close to them, the infrastructure and the technology is not there to back them up either. You can't just transfer calls out, right? And so we have some TERT teams. For instance, Atlanta PD, I believe, went and helped. It may not have been Ohio. I can't remember which last disaster, but they actually had to physically up and send some call takers over to help another 911 center. If Next Generation 911 was in place, they could have just helped them right where they are, because you could just get the calls and send them to another path and send them to this other center. We don't have that right now. One of the biggest arguments, and it wasn't arguments, healthy discussions that I have had with other jurisdictions in my area. In the DC area, DC can back up anybody, right? Something happens, small call volume. You send them to us, we'll help out. No one wants to take DC call volume, though. They're like, wait, we got to take all your calls? Yeah, if I go down, who's going to help me? You know? You're like, wait a minute. But in Next Generation 911, I could split that up, right? 25% go to Arlington, 25% Alexandria, 25% Fairfax. We could actually do that, right? And that will help out. We don't want to overwhelm another 911 center or any other communications. So, the bad call, my worst call. How could Next Generation 911 help me with that call? There are a couple things that I think about, because that call is one call that I have never forgot about. My son was 1 at the time, and I just remember the girl that dispatched the call, her son was close to 1 too. And I remember when they came back over the radio and told us that, you know, what had happened, she and I just looked at each other. To this day, we never talked about it. We never got around to that. We weren't great with mental health in 911 centers back then. We're a little better now. I would have pulled her off the phone now. That's kind of how we operate. You take a call like that, come on, get off the phone, let's go take a break. Me too. But she and I just looked at each other. We just looked like humans, like, what? And you know what we did? We took the next 911 call, because the phone was ringing. Had to keep going, had to keep dispatching calls. People were still fighting, cars were still on fire, we were shooting each other. So we had to keep going. So the story behind that call, and I'll tell you how Next Generation 911 could have helped, we don't know for sure. So the young lady, she was really young, she was 19, 18 years old. She had these 2 children. A couple of days before, she took her children to her family. She was arguing with the father of her children. She said, I don't want these children anymore. I can't take them, it's too much, get them. What did her family tell her? You had these children, suck it up, go figure it out. So you had these babies, go get it. She's like, I'm kind of losing it. I can't handle this. No one helped her. She did have mental health challenges that was struggled with her. I know we find that in our communities, especially in our Black and brown communities. We don't reach out for help as much. It's getting better. But she didn't reach out for help. And she was walking down the street that day on highways, dragging these kids, popping them. Guess what? When I took that call, there were 6 or 7 other calls that had been taken about her walking down the street. But we are in a booth taking calls, right? I don't realize that Tammy over here is taking a call about a young lady that was walking down the street. I didn't know that her family member had called earlier about her leaving upset, and they thought she was, we had no coordination that way, right? We were just I took the call, hung up, thought about it, and I moved on to the next call. Next Generation 911, a couple things that, ideal world, how it could have helped. One is there would have been better interoperability, first of all, with mental health mitigation, things before. We're really big. You guys know we had the big launch of the 988, the suicide hotline, having a 3-digit number, because believe it or not, well, you guys will believe this. So you had the suicide hotline. Who remembers the suicide hotline number? 1876, right. But what do they remember? 911, right. So everyone, I have been on the phone with so many suicidal people, guys, so many, including ones that have killed themselves on the phone with me. I have done that. I have never been trained in suicide negotiations or anything, right? But we had the launch of 988, so people are feeling more better reaching out and calling and speaking, and we have all these great things. I think social media for not all the great things, but some of the great things, they are really reaching out about mental health illness and how you can get help. And then us as people and family members and colleagues, we are reaching out. But there is an interconnection there now with 988 and 911. The other thing is Smart CAD. So CAD is our computer-aided dispatch. It is where we put in all your information when you call 911, your name, what's going on, your husband's mad, what color shirt is he having on, things like that. I always use that example, but women get mad too, and it's crazy. But we could have had a Smart CAD, and that Smart CAD would have noticed, wait a minute, Karima is taking a call about a young lady with 2 kids, Susan also took a call about a lady, a mile up. Wait, is this the same person? Hey, flag, you guys might be handling the same call, right? That's smart. The other thing I think, and I know this is a very controversial term, but I think about predictive analytics, or maybe just AI and prediction. She walked for a very long time up the highway, right? And so we could have realized what she was doing and where she was walking, and something could have flagged and CAD where she was going. Because I lived in Augusta, Georgia. It's not really rural, but it's a little rural. It's a little city, rural, but there is space, right? So people can walk for a long time and not be seen. But we might have been able to track where she was and just reach out, or be able to notice that something was going on with those location pings. So, because we are on this plight, and I have taken it among myself to have this plight, there are 2 bills. And so a lot of people ask me, like, how can I help? How can I reach out? If you're ever in a situation, you're having conversations, you're in front of a lawmaker, local all the way up to the federal level, and you're trying to make small talk. You guys know something about Next Generation 911, you can bring it up and talk about it. Because I do think that the 911 centers are, and I've used this before, I actually got quoted, I think, in the Post about this, and I felt so bad, but I really felt this way. 911 is the stepchild of public safety. You don't think about 911 until you have to call it. No one really thinks about 911 until you have to call it. Whenever I would be in the grocery store and I would have like my 911 shirt on or something, I'm like, what's that? I'm like, oh, 911. Well, what's that? You call 911. They're like, oh, that's the police. No. We are us and they are them, no. But no, we are actually a profession. There are 911 professions, tens of thousands of us that answer 911. So 2 pieces of legs that are out right now that haven't gained a lot of traction. One is out of the House that I think got approved through the House and got stalled in 2021. It's HR 7624. HR 7624, which gives FCC some spectrum authority to sell spectrum and use some of that money for the $12 billion to $15 billion to overhaul the 911 system. There's another one, there's a sister bill in the Senate that Amy Klobuchar co-authored that also lifts 911 to the next generation 911 across this country. And so those 2 bills are our hopes. There are different coalitions together. I recently chaired a FCC work group that worked on 911 fees. And I know those of you guys that work in local government and state government probably was like, what about the 911 fee? That 911 fee, I'll tell you this. So I told you my annual budget was $125. About $60 million of that was operating costs. My 911 fee gave me about $11 million a year, so it's not enough. And that's just to keep me going every day. It has nothing to do with me graduating, upgrading, training, adding personnel. That's just keep me going for where I am right now. But other than the 911 fee, think about 911 this way, right? One of the sayings we always have is, help us help you. Like, I literally have said that on a telephone call with people. When people call 911, it is at the height of the emergency usually, right? It's when it just happened. It's when the kid just fell, right? It's when you wake up and your husband is having a heart attack or your wife is bleeding. You call 911 right then. And so we're taking that call at that time, right? So we want to help you help us. People call and they're incoherent, they're not making sense, they're scared, understandably. I've had to call 911 a couple times before. Even working in 911, I've called 911 my son when he was an infant. He was allergic to a medicine, and guys, I called 911 like I didn't work there for 20 years. They were, one of my call takers actually said, Karima, you have got to calm down. So it's taking you so long, oh my God, even though I know the process, right? But we want to help you help us, and I think that this is a misfortune that we have let it gone on this far. One of the things that I've always said is I can't believe that we came up with FirstNet. We didn't think about the 911 center at the same time. I don't know how that happened. I don't know if it was something about not having the right people at the table, but I do think that we have to upgrade the 911 center. The other part of that is if you know a 911 call taker, or if you have not, if you're in a position to visit your 911 center, which is sometimes in the same, I know us, OUC and HCMA are in the same place on MLK in DC, go and visit them. I mean, they're sitting in those centers, they're working 12 hours days just like our other first responders, and just check on them, see what they need, make sure that you're being coherent, because those calls do come into 911. We could do a wealth with that information. We do really good in DC with feeding information over to our JHOC, which is our Joint All Hazards Operations Center, being able to feed that, but that's not how a lot of jurisdictions work. It's very separate, and I think we could do a better job with that. So that is my plight. There are 2 or 3 other quick legislations that I just like to mention whenever I do these presentations, so people, because sometimes you may hear other ones. There was a carries law. If you guys have ever heard this story, there was a young lady who was estranged from her husband, and her name was Carrie Hunt, and this happened maybe 10, 15 years ago now. She was in a hotel room with her 2 children, an 11-year-old and I think like a 7-year-old, her 11-year-old daughter, her 7-year-old son, ages I may be off. And her estranged husband told her that he was going to come there, he was going to kill her, and domestic violence, and he got to the hotel room, and he took her in the bathroom, closed the door, and he was assaulting her, killing her. Unfortunately, she did pass away, but the 11-year-old daughter did what we tell all our children: pick up the phone and call 911. She picked up the phone and called 911, I think like 11 times. It did not go through. Y'all know why? She was on a hotel. You have to dial 9 first. It's 911. So this law was passed in, I think, 2018, and it requires that all, they call MLTS, it's multi-line telephone systems, specifically in hotels and other jurisdictions, to call 911, 911. We don't need that prefix, the 9, the 8, the whatever, dial 911. So that was definitely a hooray moment for us. The Ray Bombs Act, which came around the same time, is just, and another piece that went into the carries law is when you call 911 from a hotel, it also lets the hotel security or whoever know that you're calling 911, because for a very long time, as you guys can imagine, which they were up there by themselves, no one knew that these kids were up here trying to call 911 and their mother was being murdered. And he left and took the 7-year-old with him and left the 11-year-old at the hotel. And no one knew in the hotel. He got in his car and got away. But they eventually caught him. So it also lets someone know that someone is calling 911 in your building. The other thing in multi-line telephone systems, the Ray Bombs Act. So when you used to call 911 from anywhere, say in your office, you're in high rise in New York City, it would always just give the generic address or the main number to your main business. So if you're AT&T in, I don't know, Massachusetts, you call 911 in Texas, it would give the AT&T, because that's where the bill goes, right? Multi-line Ray-Bomb Act changes that. So when you call 911, it actually gives where you are, not where your telephone bill goes, right? So that was very important because it is sometimes hard. I think people just assume that 911 knows where you are, but usually there are a lot of calls that come into 911 that you're not talking, you're choking, you're having a heart attack, you're crying hysterically, right? And so you can't even get out your address. I mean, if you really think about it, in the middle of emergency, who knows their telephone number? Or the address here where we are right now, anybody? We had to call 911, right? And so you want to be able to have the information readily available. Even if you can figure it out, you want to save those seconds. And then the last one, which is probably the most important one, no, it's not, kind of, is we are classified, 911 call takers are classified as secretaries under OMB, which I respect secretaries. My mom was one for 40 years. But we are not secretaries. I know I have vicarious PTSD. I know that for a fact. I know I do. And so there is an act out there called the 911 Saves Act. I think Representative Norma Torres has authored that to really graduate 911 call takers to be considered first responders. We do a lot of triaging. We do a lot before the police and fire gets there. And the other unique thing that we are in 911, we're not only responsible for the caller, we're also responsible for the police. We're responsible for the firemen, the EMS, everybody that goes out to the scene, bystanders. We're responsible for all of their safety coordinating at the same time. And so that is my plight. That is Next Generation 911 in a nutshell. And I am done. Thank you.